Now, I hope y'all like juice for real because you about to get wet. We're going to jump back in time to July 28th of 2022, the day that Idaho State Lab mixed up monkeypox tests. So, this laboratory is one of Idaho's largest and most capable of running complex tests. It has been the starting place for much of the pandemic's COVID-19 testing advancements. It also has a high containment area where scientists can safely run tests for things like monkeypox without contaminating the rest of the lab. So, two samples arrived on July 28th. All right. Healthcare providers in two different parts of the state had swabbed their patients to test for suspected monkeypox infections. The lab processed the monkeypox test and sent out results. 4 days later, the state lab got a query from the CDC, Center for Disease Control and Prevention. The CDC had received samples from the same patients to confirm the state's lab results, but those samples and test results didn't match. So what happened was Idaho State Lab had inadvertently swapped the two patient samples. It wasn't just a paperwork error, though. It caused one person who didn't have monkeypox to get a positive result, but the most concerning part for public safety and health was the person who actually had it got a negative result. So, according to Christopher Ball, which is the director, okay, before the current monkeypox outbreak, the lab rarely needed to test more than one patient sample a day in the containment area. So there were a few situations where labels could be mixed up between two samples. But on that Thursday, the lab received two samples, and just what happened. Now I'm just going to read this one more time. Before the current monkeypox outbreak, the lab rarely needed to test more than one patient sample a day in the containment area. So there were few situations where labels could be mixed up between two samples. Somebody explain to me how you can make that statement I just read followed up by this one. It has been the starting place for much of the pandemic's COVID-19 testing advancements. So basically, you never got two patient samples at one time during the COVID outbreak. So I've been in healthcare for a long time. Never, not one time, have I mislabeled a patient specimen. And I'm literally talking about any specimen: blood, urine, semen, poop. I've collected them all. Literally everything that comes out of you, I've touched. I mean, not you, but, and not touching. Never mind. Now, the last two slides are my favorite. A direct quote from Christopher Ball. Mistakes, unfortunately, are part of the laboratory business. How they're handled is the measure of staff we have here. So you've literally admitted, verbatim, a direct quote, that mistakes are part of the laboratory business. And again, this is the lab chosen to be put in Koberger's arrest warrant and affidavit. So naturally the question was asked, what about earlier samples? Has this ever happened before and the CDC or the state lab just didn't catch the error? And Ball answered by saying that was part of the investigation. I'm trying to tell you, Miss Taylor, if you be watching these shows, you need to holler at your girl. I will work for cheap.